Introducing Be Heavenly, where nature meets purity. Our 100% natural virgin cold-pressed oils are a blend of goodness and flavor. From coconut to sunflower, brown nut to sesame, safflower to mustard, we've got your culinary needs covered. Elevate your dishes with the essence of nature. Be Heavenly. Taste the difference today.
Hello and welcome to Dr. VGP Talk Show. Welcome to the 65th episode of Dr. VGP Talk Show that reaches 42 million people, including 2 million across Chicagoland. In this episode, we are featuring a woman of courage, a woman of action, a woman of success who has 20 years as a legal assistant in one of the world's largest law firms, Sidley and Austin in Chicago. And a personal instance in her life made her build the biggest and the largest behavioral health agency in Southland of Chicago. The Chief Executive Officer of the Lincoln Option Center, Dr. Twin Green. The Lincoln Option Center celebrated its historic 30 years of incredible service in improving lives and shaping the future and building healthy communities in Southland. Today, they are certified, the first certified community behavioral health clinic in Southland. There are over 1,500 behavioral health agencies in the state of Illinois, and out of them, only 19 were awarded through the federal government and the state government of Illinois Department of Health and Family Services. The Lincoln Option Center is today a certified community behavioral health clinic. Let's have an exclusive face-to-face with the lady behind this and find out how she built the Lincoln Option Center and how she's taking care of the mental health needs, not only of the young people, but everyone. 1 in 5 American adults suffer from some mental illness. Sit back, learn, and not only celebrate her success and share her pride, but let us spread the information that mental health illness is just like any other physical illness, and it's part of the holistic health care, that we should remove the stigma of going and visiting a behavioral health center or seeing a psychiatrist or a consultant psychologist. We should take care, just like when we have a headache or we have an eye problem, we go to a neurologist or an ophthalmologist. Going into a behavioral health center is an everyday thing which we must encourage all of our kith and kin, friends, family in the community. That's the only way we can be a healthy community. Join me as we listen and hear Ambassador Dr. Twin Green. Hello and welcome to Dr. VGP Talk Show that reaches 42 million households, including 2 million across Chicagoland. In this episode of Dr. VGP Talk Show, we have a phenomenal story to showcase a woman born in Inglewood in the city of Chicago and who rose up to head one of Illinois State's top behavioral health agency, which is celebrating its 30th anniversary with the theme Empowering Minds, Linking You with Options. Welcome, Dr. Twin Green, the CEO of the Lincoln Options Center in South Holland. Thank you so much, Dr. Green, for joining us today on the show.
Thank you, Dr. VJ. It's my pleasure to be here.
Good. Dr. Twin Green, you are a flamboyant. You make things happen, not only in Southland, but across Chicago and across America with your passion to empower minds and link them with options. As the founder and the chief executive officer of the Lincoln Options Center, I know that you have a story to tell us how all this came about. It's now more than a 30-year-old institution.
Yes.
You were born in Inglewood. At the time, Inglewood, as you all know, is famous even till today. I shouldn't say the famous. I don't know how I'll call it, but that's where the highest rate of violence in the whole country, especially gun violence, is still going on in our times. You were a legal assistant for over 20 years in the Sidley and Austin law firm, one of the largest law firms in the country, in the Loop. So go ahead, tell us your story, Dr. Green. How did TLOC, the Lincoln Options Center, come to be?
Okay. Well, as you stated, I was born in Inglewood, and my mother and father moved us from Inglewood when I was 3 years old because my father saw the change in the community, and I had teenage brothers, and he really didn't want his sons to get caught up in the change in the community. So we moved to a brand new community where the expressways had not even reached past 111th Street, and that was the Morgan Park community. Went to Morgan Park High School, as many proud others did as well, and started working at Sidley and Austin. So all of this development of the Lincoln Options Center really started at Sidley and Austin. Had the most rewarding time there, working for Judge now, then partner, Lindsay Jones. And Lindsay and some of the others saw my passion. So while at Sidley and Austin, Sidley had a benefit that they gave all employees, and that benefit was to have access to the legal professionals at Sidley, and they incorporated me. They saw my passion to have a nonprofit organization to help young people stay in school, help mothers that were struggling with having a safe place for their children to go after school. And that's how the Lincoln Option Center was formed. And empowering minds and linking youth with options was our tagline at that time, because we're a youth services focused agency. Moving forward, my son, at the tender age of 9, was what we now know suffering from detachment disorder, which is
Detachment
disorder.
What, could you explain what that is?
Yeah, a detachment disorder in the mental health field is when you're separated from something and it creates a traumatic experience. So now we know what trauma means. Well, my son, when I divorced his father, had to deal with the separation of his father not being in his life. So as a young mother, raising a 9-year-old child, male child, after divorcing his father, He moved to Southern Illinois, and that separation caused my son to go through what we now call detachment disorder. And that is a disorder where if you're separated from someone and it really reaches inside your soul and it makes you have anxiety and depression. So that's what a detachment disorder will do for one. I didn't understand what my son was going through because I was raised with both of my parents. And my son was, for lack of a better word, a daddy's boy.
I think that's very significant today because we see so many single parents around.
Yes, yes. And so as I struggled with my son, not understanding his mental health challenges and his inability to express his feelings, he started to act out in school. And so the school started looking at him as having behavioral problems. Well, it was intentional in his mind. He was intentional in causing a ruckus in school so that he could force his mother, which is me, to send him to his father. But that did not work. So unfortunately for my son, his father did not receive him, and that hurt him even more. So I decided, as I listened to my son and his friends, as mothers do, you're listening to your children as they're talking in the little groups. And I can hear the same story from my household to his friends and their households. They're all talking about how they wished their fathers were still in their homes and how that made them feel. So I decided to leave corporate America and start an organization because I could not help my son overcome his mental health challenges that he was experiencing, but I figured I could be a blessing to someone else. So my pain and my son's pain became someone else's glory. Started the organization.
You said it so well.
Yeah.
Your pain and your son's pain became somebody else's glory, and that's how gave birth to the Lincoln Options Center 30 years ago.
And the community really failed us, and that's a very important part of this whole story. We were challenged to go to counseling, went to counseling, and one of the largest organizations, I will not name that organization publicly, but we had to go to counseling. We went one time, and that was the worst experience that my son and I could have ever experienced. And that is really what made me decide to take my pain and make it benefit someone else. And that is the real reason why the Lincoln Option Center was formed. So I could be a help to another mother that was going through what I was going through and didn't know how to find those important and vital resources to help my son and me.
So, Dr. Green, your mission in forming the TLOC, the Lincoln Option Center, was to empower people with quality prevention as well as intervention services coordinated with a whole network of resources.
Yes.
And what is the, I see that your vision was to have an integrated system of care built on a collaborative relationships that promote positive decision making, especially in the youth, like you currently said. So tell us all about the treatment philosophy of the TLOC, the Lincoln Option Center now, and all the different services you offer. You also have other offices. Please let all our viewers come to know about the work you're doing because it might help somebody out there.
Absolutely. I'd love to. So our philosophy is true. You cannot do this work without a network. There is no silos in mental health. You have to have a coordinated, integrated healthcare system in order to ensure that all of your patients, your clients, whatever you may call them, are getting everything that they need, because when people come to you, they do not come with just one concern. There are many different concerns. And we look at healthcare as an integrated approach, integrating the medical and physical health alongside behavioral health. And that is so important. We do not look at the person as one person. We look at the person as
Holistic.
person. Absolutely. So when we started, we just focused on youth services, after school programs. And then over the years, those little darlings that I had come into my organization after school, they started sharing what was going on in their homes. Dad could be incarcerated, or there was drugs going on in the home, or there was crime in the community. So those kinds of situations then made me say, I need to expand our services to include mental health and addiction treatment, case management supports, housing stabilization, all of those things together to make sure that every household was made whole. Well-being, however you need it to be, is what the Lincoln Option Center's linking you with options and empowering those minds. That's why we base our concept around that approach. All psychiatric type services. That's what we do. Mental health, addiction treatment, medication management, monitoring, case management supports, housing, crisis stabilization. There's just a whole litany of support services that come along with doing this kind of work. And we started with community mental health. That was the big draw, community mental health, because we are in the community, visible and accessible to people that can come to us when they need it, get the services by whom they would love to have it provided to them by. That's always important too, to have that cultural competency and
The cultural pride.
yeah, absolutely, that cultural pride. So we have 4 locations.
Oh,
We have 2 locations in South Holland, and we also have 2 locations in Hazel Crest. One, there is a lot going on in the world of healthcare, and we have stepped into that space over the past 30 years in a slow pace. But when I look back now, 30 years, we've moved from a youth services organization into a community mental health center, and now transformed into a certified community behavioral health clinic.
Today, 1 in 5 adults in the United States of America experience some kind of mental illness.
Yes.
And over 30% of the young adults are struggling with anxiety, depression, loneliness. And the Lincoln Option Center, I see, also provides trauma-informed care. Could you tell us what the trauma-informed care is about?
Trauma comes in so many different ways. We know, just look back at COVID. COVID itself was a very traumatic time that everyone experienced. I know everyone had some experience with isolation and anxiety because we didn't know what the next day was going to bring. We were afraid to come outside in some instances. And so the traumatic experience of that by itself, not knowing what else to do or how you're going to overcome something, that is what people live with every day. And then we have street violence. So trauma-informed care is looking at that person in real time, understanding what got them to that place, what triggered that experience. And now we're looking at them, not judging, but being a partner in that listening path and understanding the trauma, that event. Trauma is an event.
I mean, I like
It's an event.
I like the way you put it. Now, tell us, how many clients are you currently serving, Ambassador Green?
Annually, I think we have about 7,500.
Wow, 7,500 clients.
Yeah.
That's a huge number.
Yeah.
Huge.
We not only serve individuals, but we serve families. So those numbers add up, because you can have 3 or 4 or 5 family members. So each person in that household counts.
Great. Now, I also heard that you are one of the leading agencies during COVID and post-COVID that is providing telehealth. And you were a pioneer in that, setting yourself apart from other agencies. So tell us, how are you still providing telehealth services to your clients?
Yes, absolutely.
Has that been effective in delivery of services?
Very effective.
Expanded your base?
It really did. During COVID, we lost a lot of clients because we could not have our clients to come inside of our facilities. So given the fact that we were able to then launch telehealth services so that we wouldn't leave people behind, that was the breaking point right there. And I think having the infrastructure, the federal government gave a lot of support to organizations so that we could build the infrastructure, we could see our clients, and they would be able to have the care that they needed without coming outside of their homes. We do a lot of telehealth with our management department. So our psychiatrists, our nurses, they're able to do patient remote monitoring. We had about a $15,000 grant from Blue Cross Blue Shield. So we have a state-of-the-art med management station in our South Holland facility. And it's been the best thing that we could have ever done and not leave someone without care.
That's excellent, because I think also COVID brought something good during its time that the pandemic was here. In 2021, you were a pace setter and a trend setter. You started the Citizens Action Alliance for Behavioral Health. You brought together over 40 behavioral health providers in Chicagoland and made an ad hoc body so they can all come together, collaborate together, talk about the challenges they faced and the solutions. And that's why, and you were named their ambassador. So we can add, Dr. Green is the ambassador, the global ambassador for the Citizen Alliance of Behavioral Health. And you also had a historic first there. For the first time in the history, Ambassador Green, along with the Citizens Action Alliance for Behavioral Health, brought together the managed care organizations, CEOs, and providers to meet with the behavioral health providers to talk and dialogue about their challenges and their problems. Would you like to throw some light on that initiative which you started?
I think that was a game changer.
Yeah.
That was a real game changer for providers across the state of Illinois. And we invited all providers to come. We had a wonderful facility, MedStar in Hillside, opened their doors to us. And we had legislators that were there. State Representative LaShawn K. Ford helped to spearhead and get the MCOs to come to the table, along with yourself, Dr. VJ.
And Congressman Danny K. Davis was there. I think Congressman Raja Krishnamurthy was also there.
So we had great support from Congress all the way down to the state level. And it was just an awesome time. All of the MCOs, they showed. And we had over nearly 200 providers, I do believe, at the event.
What I'm trying to tell our audience is Dr. Green, after setting up her own behavioral health empire, wanted to share and bring other behavioral health agencies, maybe established ones, maybe fledgling, to get together and become the shared power of a network, of an alliance of behavioral health. I want to salute you on taking that leadership initiative. And I know you have something more planned for all the behavioral health agencies in this year. Tell us what everybody is talking, Dr. Green, I should say Ambassador Dr. Green, about the Medicare 1115 waiver. There's so much talk about it. It's about the social determinants of health.
So the 1115 waiver, actually just today, I had Director Whitehorn visited our facility.
He's the Illinois.
Yeah, the Healthcare and Family Services. She's the director. Great. And she and a couple of her staff came from Springfield, actually, as far as Springfield here, intentionally to hear about the services that the Lincoln Option Center provides and how much they value us as a partner, a vital partner and value partner with the state of Illinois. But the 1115 waiver, Director Whitehorn did mention that today, and the state was just approved. So there's still a lot of work, to be done on it, but it's going to allow more services to be provided where generally we would not have those funds to provide a lot of the case management support services that people need, housing supports, and the such.
Transportation,
Transportation, yeah, all of those social determinant of health needs that people need every day. This is not,
I mean, that would revolutionize behavioral healthcare delivery, because I think some of the reasons why people suffer from anxiety, depression, economic distress, unemployment, housing needs, food.
Absolutely.
Food security.
Yes, absolutely.
So this would be a huge ingredient for a successful behavioral health services to be provided. And I would like to congratulate you with the state director's visit. One of the greatest things, Ambassador Green, what's happening here in Southland, you have become the first certified community behavioral health clinic. Congratulations on that. I would say thumbs up. Now you're going to tell us, what does that mean? And what all new services, and how are you going to provide that to the whole of Southland? Being the first, you can tell us the geographic area of Southland and go and tell us everything we need to know, and all our viewers need to know about the certified community behavioral health clinic, the first in Southland. Ambassador Dr. Green, congratulations on that historic feat. It's your pioneering work for 30 years, and your soulsome focus and passion. We salute you on that.
Thank you. Thank you so much. I'm really excited about being in this space. A couple years ago, the state created healthcare transformation. And I was actually devastated when we did not get selected as one of the providers for that, because it was intended for the South suburban area. All of the resources went to the Chicago area, and nothing came down our way. And that's been my fight for 30 years being in this game. So when the opportunity came last September to apply for certified community behavioral health clinic application, I jumped to it and had some of the best consultants on my team. And it took us about 6 months, that certification, the readiness. You really had to show the state that you were ready to be a part of their application, because the state had to be certified in itself.
The federal government had to certify the state first, and then the state has to pick and choose the agencies capable of becoming certified and deliver
their application. So there were 19 chosen CCBHCs, and out of, I think there may have been about 30 other organizations that had applied, but only 19 made the cut, and we are the only in the Southland.
Wow, that's a real heartening, I think, for all the citizens of Southland. So the ribbon cutting ceremony for the first Southland's TLOC's certified community behavioral health clinic is taking place on November 8th.
Yes.
And I think you have great plans. You've added a huge communication outreach community team.
Yes.
I think you have got a Superman, Howard Little, to do all the videos and, bring it alive into the households of what TLOC and the CCBHC is doing. And you're planning a series of town hall meetings to get the community involved, to bring awareness to them. So tell us something about that, and also especially about, you're going to have a mobile response unit.
Yes.
And then you're going 2 steps forward, or 3, in having a mobile healthcare. Tell us about that.
So in order for us to actually be a part of the application process, we had to do a needs assessment, a community needs assessment, which all organizations are really required to do that over periods of time anyway. But we did ours in the Southland, and it was an eye-opener. We've always been a part of CMAP or the other hospitals' community needs assessments, but we had to do our own. And we were very intentional about the focus areas and entities that we reached out to let them know that this is what is coming for them, but also to get their input on, is this what you need? Because that is the difference. Bringing things to the community to say, okay, this is it, and not including the
Absolutely.
community.
You're taking the community along, you're going into the community, getting the feedback,
Yes.
you're organizing town hall meetings and telling them these services are available. You have a mobile unit. I mean,
Yes.
this has never happened
Yes.
before.
No.
There's something new, and everybody is excited for that.
Yes.
Coming on a personal note, Dr. Twin Green, you're such a multifaceted personality, transforming communities, shaping the future. Tell us, if you are given an opportunity to take 3 people out for dinner from the past to the present, who would those 3 people be? Is something to give our viewers who are your mentors, who you owe what you are today for, or who are your besties?
I would take Dr. Felicia Blassingame,
Wow.
which is my bestie, my mentor. And let's see, another I think I would take would be a big champion of healthcare, which is Representative Ford. The third I think I would take to dinner would be Vice President, soon to be President, Kamala Harris.
Wow. You just heard Dr. Twin Green selecting her 3 people she'd like to take out to her dinner. Her mentors, one is the current Vice President of the United States of America, Kamala Harris. Second is State Representative LaShawn K. Ford. And then her bestie, Dr. Blessings.
Yes.
That's great. In 3 words, Dr. Green, how would you describe yourself? 3 adjectives.
Very, very passionate.
Passionate.
Very passionate. I'm very intentional and focused.
Very good. It was about to come out of my lip. Dr. Twin Green describes herself as very passionate, very intentional, and very focused. And thank you so much. It's such an enlightening interview and talk show with you. You had so much to share, and I'm sure we'll be here back again. And we're all excited for the red ribbon cutting on November 8th here for the first certified community behavioral health clinic. And we're going to have the town hall meetings, 2 meetings in a month, maybe 2 towns in a month. Now, your parting message to our viewers. I know the current state of mental health in the United States is very serious, complex, and intertwined with ongoing opioid overdose crisis. The young are 30%, 1 in 3 youngsters are struggling with anxiety, depression, and isolation. The public health experts say that in 2020, America's greatest crisis is going to be mental health crisis. Dr. Green, your message to the community at large.
The community at large needs to know that we have a certified community behavioral health clinic serving all of the Southland, all ages, regardless to your ability to pay, regardless of age, and regardless of where you live. These services are open to you 24/7, 365 days. There is no wait. Access to care is immediate to you. Please take advantage of the services that the state of Illinois has brought to you through the Lincoln Option Center. And we are here. We're here ready and waiting for you to serve you and with all of your needs. So
we have the 1-800 number rolling down the screen.
Yes.
If you know of anyone anywhere, please call the 1-800 number, and Dr. Twin Green and the Lincoln Option Center will be there to help all of us. Thank you so much, Dr. Green, for joining us today.
Thank you.
And it's really, you are building healthy communities, and through your services, you're fostering and promoting a positive spirit among youth, including not forgetting the cultural pride, which all ends up to economic success. And that's what builds healthy communities.
Thank you, Dr. VJ.
Thank you so much.
Thank you, listeners.
Introducing Be Heavenly, where nature meets purity. Our 100% natural virgin cold-pressed oils are a blend of goodness and flavor. From coconut to sunflower, groundnut to sesame, safflower to mustard, we've got your culinary needs covered. Elevate your dishes with the essence of nature. Be heavenly. Taste the difference today.